And thank you all for joining us today. As Jamie and I really go over some of the tools we built at CARES, visualizing the impact of COVID-19 on people in place. A little bit of context before we dive into the COVID-specific tools that have been built. CARES is, again, the Center for Applied Research and Engagement Systems. We're housed in the University of Missouri Extension and Engagement. And it's very exciting to be involved in working with Extension because CARES was founded back in 1992. The focus of our center is really around better understanding people in place by using spatial data or geographic information systems, looking at reporting systems, other types of tools to help people understand the context around conditions, whether it's around health, education, the economy, around ag, the environment. We have a wealth of data that helps support that. So over the almost 28 years that we've been together, we've really focused at the core of what we do as a public good utility. So what we're going to be sharing with you today is publicly available. So at the core, the core of our mission is really around making public data and visualization tools available to all communities around the country at no cost. And from that, we're able to really dive in more deeply with a number of organizations, nonprofits, foundations, federal and state agencies, to do a deeper dive around very specific project areas. But what you're going to be seeing is all publicly available. And with that, we'll go to the next slide, Jamie. So this is our national website, the CARES Engage. Go back one, Jamie. Thank you. The CARES National Engagement Network. This is where you're able to make a map or build a report or use a number of different tools on our system. We moved to the University of Missouri Extension about 3 years ago because what we've learned over the many years of working with place-based initiatives, whether it's with foundations or federal agencies, these place-based activities around health and engagement, we've learned that there are a lot of local and regional nonprofit organizations that may be here today, but may not be there tomorrow. So by moving to Extension, what we're most excited about is marrying the high-tech capabilities that we have at CARES with the high-touch and outreach dimension that Extension offers. So we've really enjoyed the move to Extension because it really does affect change in the most meaningful way. And I'll get into that a little bit more after Jamie goes through some of the dashboard or COVID-19 cards. So on the website, we'll be providing both websites, the national website, which is the engagementnetwork.org, as well as the All Things Missouri website. What she's going to be sharing with you is really built off of what we did for one state, the state of Missouri. So that's a modus operandi has been, how do we build dashboards, story maps, and other tools and refine them in Missouri, but then rapidly scale that up nationwide? What you're seeing is an example of what we did related to these COVID tools. First focused on what data, what indicators we wanted to pull together, how we wanted to tell the story. And then since we have all this data available nationally, how did we spread that word, so to speak, and make that available as national tools? So with that, I'm going to turn this over to Jamie as she's going to be going through several of our dashboards.
Great. Thank you so much, Chris. I really appreciate that framing and a little bit of information about CARES. And so, yes, what you're seeing here on the screen today is the homepage of the CARES Engagement Network. And so if you did want to follow along with this webinar, you're welcome to go to engagementnetwork.org and follow along, and you'll find all of the tools and resources that we're going to highlight today. Now, typically, we do most of our presentations as a live demonstration, but testing out these tools as over Zoom, we realized that we were just probably taking too many chances with our internet and our bandwidth to be able to do it live. So we're happy to show you through these tools via some slides today, but just wanted to let you know that these are all interactive maps and resources that you're able to click through and learn more as we get through this. So So what you're seeing here is that link again, engagementnetwork.org/COVID-19. That's where you'll find our full suite of national COVID-related reporting tools. So the first one, and the one that we're going to spend a lot of our time on today, is this national COVID-19 dashboard. So as Chris mentioned, we first built this for Missouri, for the state of Missouri, and for every county. And what we realized is that we couldn't just stop there, that we had to do this nationally. We had to build it out for every state and for every county. And we hope that you'll see this as a really great resource for you to better understand how COVID is impacting your county and your surrounding counties, and then also how it's affecting your state. So we'll dive into some of those pieces. So that national COVID dashboard, just to let you know, is updated daily. So we do have several data feeds that provide us with the data that are in there. And many of those you'll probably recognize from John Hopkins and from Google and those types of sources. So we are trying to update those as frequently as possible. So you will see daily updates on that national COVID dashboard. The second tool that you see here is this vulnerability footprint. And I'll talk a little bit about it, but we're not going to be able to dive too far deep into it today. But basically what we were able to do was use a previously existing footprint tool that we had available. And we just looked at other types of indicators that are going to be, we feel that are going to be most impactful when looking at recovery from this COVID-19 pandemic. So those three indicators are the population density, percent uninsured, and then the number of individuals who are over the age of 65. So I'll show a little bit of that later on in the presentation, but we do find that vulnerability footprint to be very powerful, and we will be having a follow-up webinar that just focuses on that vulnerability footprint too. Next is the COVID-19 testing dashboard, and that'll be the second thing that we dive pretty deep into today. This was a partnership with US News to be able to really stand up a dashboard for states to look at to see where they're at in terms of meeting the daily testing thresholds, and then also keeping those positive test numbers under a 10% threshold. So I'll show you how that works here in just a couple of slides, but it is a really interesting view at a state level, especially as you think about what policies and regulations are being put in place across the United States. The next is an indicator report. So we've compiled some daily updates of COVID indicators alongside, again, some of those social determinants of health, where you can create a pretty interactive report for your county or for your state. And then finally, for those of you who are interested in looking at maps, we have created a series of starter maps as well. The one that I have demonstrated here is an economic impact map. So they're really topic-based or issue-focused, and they're maps that you don't have to create. We've created them for you. So you can find all of these tools at that link above, engagementnetwork.org/COVID-19. So encourage you to take a look at the ones, especially that we're not going to be able to spend too much time on today. So here we are. This is really the homepage, I guess you would say, of the National COVID-19 Dashboard. What you're seeing here are basically, it's a point level information about cases, incidents of both confirmed cases and then also deaths around the United States. So as I mentioned, these data come to us from Johns Hopkins dashboard, their COVID dashboard, and they are updated daily. What you're able to do here on the right-hand side, you can see that we have a list of states. So you can select a state and the map will automatically zoom into that state. So here you can see I've selected the state of New Jersey. It gives me a nice little outline to tell me that I've selected the correct state. And then what happens, instead of seeing the number of cases across the United States, you see a county level view of the number of positive cases and the number of deaths. And so that's sort of what you're seeing over here as we're looking at the different counties that make up the geography of New Jersey. So this is really just a really great dashboard to look at as an overview, sort of a daily check-in, where are things happening, are rates going up and down, how many more deaths are we seeing, are there states that we should be more concerned about? So this is very akin to that national or to that international Johns Hopkins dashboard. But what we've done is we've just centralized it to the United States to be able to look at the states here. So clicking through, you'll notice that at the bottom of that dashboard, there are some tabs. And so it says, use the tabs below to navigate through the dashboard. And so that's sort of what I'm going to do for you here, just with slides instead. So the first tab, or the second tab actually in this national COVID dashboard, is looking at two really important indicators. So the first one is the total confirmed cases, right? And that's the blue side of this map that you're seeing here. So we're looking at no cases being those white counties, and we're looking at over 250 cases being those dark blue counties, right? So we can see some variation in where we have sort of hot spots of positive tests. But on the other side of things, we're looking at cases per 100,000 persons. And so that's really where the slider, you'll notice that I have this nice gray line here in the middle of my slide. And if you're on the site, that's actually interactive, and you're able to swipe from one side of the map to the other and see those two layers. And the reason that this is really important, or we think it's really important, is because it really shows us what's happening in rural areas. Not every county has the same population. So 2 cases in one county may be a lot less, right, in terms of the percentage than 2 cases in another county that has a smaller population. And so that's really what this dashboard, this part of the dashboard, is trying to show us, is what's the percentage of cases per 100,000 people? What's the population or the prevalence among the population that we're seeing there? And what we're able to see is that we do see, especially in those rural areas, that we do have high rates of positive tests in some areas where we see that the total number of confirmed cases looks low, right? But when we actually look at that compared to the actual population of that county, it's quite high, or it's starting to reach some of those danger zones. So you'll see here that I have the map zoomed into the state of Iowa. So I've selected the state of Iowa. I can see very easily the outline of every county here. And so I'm able to sort of identify a county that I'm interested in and counties around that county to do some light comparison. I'm also able to see here on the right-hand side the total number of confirmed cases for the state of Iowa and the total number of confirmed deaths. And again, then we also get that nice county level list view. So we can look at Polk County, Black Hawk County, Woodbury County. If I were in the interactive tool, I could also click the counties on the map, and I would also receive that same information. So this is the map itself is interactive and clickable. So just wanted to point that out as well. I did take these screenshots yesterday, so I just want to put that out there, that I tried to wait till the last minute to do it, so the numbers were as accurate as possible. But if you are looking at this today and you're looking at what I'm looking at, the numbers might vary slightly, because we did do, like I said, an update this morning. So just gonna kind of throw that out there for you. So again, thinking about how we look at urban versus rural, looking at this type of map and using that swipe layer is really going to be able to help us look at how COVID is impacting more populous areas and less populous areas, and will help us develop additional strategies to combat that, especially in rural areas. So continuing on through those tabs at the bottom, the next set of tabs are really around vulnerability indicators. And so what we've been able to do, again, for every state in the nation and for every county, is develop these dashboards. So there are 4 specific vulnerability dashboards. The one that we're looking at right now is just looking at basic demographics. We also have one for economic vulnerability, health vulnerability, and mobility vulnerability. And we'll take a look at those in some subsequent slides. Just want to make sure that you guys are aware, though, you can click through those there at the bottom. So here first, we're looking at demographic vulnerability. And so I've chosen Carbon County in Montana, which has about a 10,000 population. So we're looking at a fairly rural area here in comparison to the state. They haven't had very many confirmed cases, and they've had 0 deaths, which is great, right? As we're thinking about the overall health of this community. But a couple of things that sort of struck me as I was looking at Carbon County, and the reason that I wanted to use this as an example. So first off, I wanted to point out the median age. So one thing that we do know about COVID is that it is affecting our older populations harder, a little bit more than some of our middle-aged or younger populations. So this is an example of being able to identify a particular vulnerability in this county. The vulnerability here that we see is we have about 2,600 folks that are age 65 and over. And that is the largest population, age population in Carbon County. So they make up the majority of the people that live there. We can confirm this by looking at the median age. So you can see over here that population is reflected in this nice bar chart. We can see that age 65 and over. We can then see that the median age here is around 50.3, and the state average is much higher than the state average, which is 39.8. So again, that gives us a little bit more information as we're thinking about moving forward, protecting the most vulnerable, and recovery. Carbon County would be one of those counties that would really want to start thinking about strategies to support that population that is age 65 and over, identifying where they are, and then identifying maybe additional health considerations, which we can continue to do using some of these dashboards. In addition to that, I also wanted to point out that we have some other great indicators here. For example, the disabled population. We can also see not only do we have a large population that is age 65 and over, but we also have a larger than average disabled population. So that 15.9% rate is greater than the state. So we might have a little bit more vulnerability lying within that disabled population than other parts of the state and other parts of the nation. Again, how do we start to support those folks, as this continues on and as we look towards recovery? Finally, here on that last line, what we're looking at are licensed beds, staffed beds, ICU beds, and then utilization rates, right? So for Carbon County, looks like they have a pretty typical ICU bed utilization rate. It's not terrible by any means. But I think what's most interesting here is that the number of licensed and staff beds and then the ICU beds is very small. So what we can probably assume, and people from Carbon could probably confirm this for us, right, is that there may not be a rural hospital in and around this area, right? They may need to travel pretty far to receive proper services if they were to get sick. And so that's another opportunity. Is there an opportunity for maybe some mobile ICU beds or to co-op with another facility just in case we do start to see the number of cases rise and the number of deaths rise? So that's a little walkthrough then of those demographic vulnerability indicators. Again, I would encourage you all to look at your own community, your own county, and other counties within your state just to do some comparisons. Moving forward, we do also have economic vulnerability here. So, for example, I've chosen San Juan County in New Mexico. And so what we're seeing here are some economic-related vulnerability indicators. Again, we still get some of that same information from dashboard to dashboard, which includes those total cases, those cases per 100,000, the number of deaths, and the number of deaths per 100,000. So that is going to be consistent across all of these dashboards to sort of root us in the current reality of the number of cases, right? In addition to that, though, we're also looking at, for example, indicators like population and poverty. So we do have a slightly higher, probably not statistically significant higher population in poverty, but it is something that maybe San Juan County would want to start to pay attention to. We also have a slightly higher uninsured population. So that could be an area of concern for San Juan County, knowing that they have a 14.5% rate of uninsured folks living in their area, means that those folks may be less likely to seek medical treatment because they don't have health insurance. They might have some fear around seeking medical treatment because they don't have health insurance and they're not sure how they'll be able to afford treatments or testing. And so outreach and education to those folks would probably be a good strategy for San Juan County to be thinking about. We also have a couple of other metrics around broadband. So broadband is something that in Missouri we've been very focused on and we've been talking a lot about. And we started talking about it actually before COVID happened because we recognized that we were probably missing out on a lot of economic opportunity and growth opportunity, especially in rural areas, because we don't have great broadband or great internet access in a lot of parts of our state. We're learning that that is so true, and it's being sort of doubled down at this point, recognizing so many people are working from home and trying to access online tools like Zoom and other types of remote meeting, right? So here what we're looking at is that the internet usage, households with no internet is around 31.4%, and the state is around 23. So that's a pretty big delta there. And so that could be another strategy for San Juan County to think about, how do we recover from this economically? Is there an opportunity to increase bandwidth around broadband to folks in our community so they can continue to have economic opportunities? Again, continuing down this dashboard, we also have unemployment rates. So we just did receive an update on employment for March of 2020. We do not have April numbers yet. Those probably won't be released until later, probably early June, I'm guessing. And so we have been able, though, to look at what the changes are from the beginning of the year through March. And what you'll see here is that this county does have a very significant unemployment rate at this time. It's 7.3 compared to the state average of 6.5, knowing that prior to March, we were all sitting somewhere in the 3s and 4s. So that has been a pretty significant increase for this county and many counties across the United States. We have median household income, which it looks like San Juan is slightly higher than the state. So that could be a good indicator for maybe some continued recovery. And then also GDP. Finally, we're looking at this bar chart here on the right is showing us job sector. And I recognize that the font might be a little bit small for you guys to read on my slide, but a couple of things that I wanted to point out here was the 3 or 4 highest employers, in San Juan County are the ones that I think the United States are most worried about, right? So here we have education, health, and social services. We're worried a little bit about the next one is arts, recreation, entertainment, and food services, which would include our restaurants and caterers. This purple bar is retail marketing. And then finally, this last yellow bar is agriculture, forestry, and mining. So those are all areas of the economy that we've probably heard from others, from our states about being concerned about, right? We know that folks aren't shopping because businesses have been closed. We know that universities are worried about whether students will be back in the fall. We know that food services have been impacted significantly since there's not there's not populations going out to visit restaurants and other types of food services. And so again, what are the opportunities for San Juan County to help mitigate some of the potential damage to these industries and these employment sectors as we're looking forward? So some really great stuff here in that economic vulnerability dashboard. Moving forward, looking at health. So I've changed my location again. Now I'm looking in Minnesota. I wanted to try to hit sort of all parts of the country today if possible. So we're looking at Blue Earth County. And if any of you are familiar with Minnesota, that's really kind of the Mankato area, right? So not super populous, but it's a metro. So here we're looking at, again, we've got that baseline information, the number of cases and the number of deaths. And it looks like, Mankato, that area, the Blue Earth County area, doing pretty good in terms of the number of deaths. They have seen some cases in that area, though. And so the reason that this is important, or these health vulnerabilities are important, is because what we know, again, is that there are some populations that are being hit a little bit harder than others. And so those that have pre-existing conditions are those that we are going to worry the most about. And so here we see we have a pretty high smoking rate when it comes to comparing themselves to the national average or to the state average. It looks like a lot of folks, there's a pretty high rate of smokers in this area. We have a slight increase over the state average related to high blood pressure, and that is also true around diabetes. Then we get into an indicator like high cholesterol, where we see a huge delta between that state average and then that Blue Earth County. Cholesterol hasn't been directly linked to any COVID-related deaths or problems, but it is definitely a pre-existing condition that could cause someone to be more vulnerable. In addition, we see asthma and then that cardiovascular disease as well. So here there are just some opportunities potentially for Blue Earth County to say, how can we look at some of these health indicators and say, we have some populations that we need to reach out to, or that we need to be providing additional support to, right? So I think that health vulnerability is also great. One thing to note here is that the high blood pressure, diabetes, high cholesterol, asthma, and cardiovascular disease indicators are reporting Medicare beneficiaries with those conditions. And typically that would be, we want to make that available to you and for you to know. And typically we would say, oh, well, that's just excluding a large portion of our population. But in this case, we are really looking at that older population a little bit more closely. And so these data, I think, are more meaningful than ever, even though we are looking sort of just at that subset Medicare beneficiary population. Finally, we're looking, the last slide here is looking at county mobility vulnerability. And so what we've been able to do is pull information from Google. So Google has a great, they just launched sort of a beta version, right, of a mobility set of reports for every county. And I actually think it's international. So these mobility indicators are new, but what they're doing is they're really looking at Google tracking data. So I know that we all are aware that we're being tracked by our phones and by our searches and by our GPS, right? And so Google has, I feel like, put that data to really good use here, telling us sort of what changes are they seeing in terms of economic vulnerabilities and then the mobility vulnerabilities, right? So, and I think am I on the wrong? Oh, nope. I think my slide, there's a slide missing here, but that's okay. Those mobility vulnerabilities are looking at some indicators related to are people going to parks? Are they using parks? Are they not using parks? Are they going to work? Are they not going to work? So one of the indicators that I had pulled up was, in Boone County, Missouri, which is where the University of Missouri is, we saw about a 60% decline in mobility around the Columbia-Boone County area. And that's because so many people are not driving to work. We just don't have folks moving in and out of the county to buy goods and services, to go to work, to take their kids to events, to take themselves to events, right? So those mobility indicators have been really helpful in understanding potentially what the economic impacts are, what the environmental impacts are, and then sort of what maybe some of those longer term impacts could be. So would recommend you take a look at those. And if if you want more information, the last tab here in this dashboard is sources, and it takes you back to all of the original source information for these data. And so if you do have questions around what is Google tracking, they will tell you what they are tracking. We will tell you also where we got data for the other vulnerability indicators using national secondary source data from sources like the CDC, from other types of research institutions, and obviously from the American Community Survey on the census. So that's a brief overview then of that national dashboard and what you can get there. Moving forward, we did want to talk a little bit about the vulnerability footprint. So this is an example of an output from the vulnerability footprint. When you click on that card on the engagement network or on All Things Missouri, the first thing it's going to do is it's going to prompt you to enter a location. So when you enter a location, you can select a city, a state, a county, or a zip code, whatever your geography of interest is, and it'll zoom you automatically into that area. You can use the plus and minus buttons on the left-hand side of the map to sort of get it to the extent that is most useful to you. And here I've selected Houston. It has a nice variability in sort of some of these indicators and is a good example area to show. So we're looking at Houston and sort of their metro area as well in this map. And we see several colors on this map. And so I do want to just take a minute to explain to you what these colors are saying to us. So the three indicators that we've identified, population density, uninsured population, and population age 65 and over, are all represented by a unique color. So the areas that we see that are in blue are areas where the population density is greater than 1,320 people per square mile. So the important thing to note here is that number, that threshold, is modifiable. And so what you can see, there's like these little sliders here under this population density. I could move those back and forth within the live tool and be able to say, well, I'm in a rural area, so population density isn't as important to me, but I'm still curious, right? I still want to include it as part of my footprint. But for the more populous areas, for the more urban areas, the idea is that you would move that up. So you would find the most dense areas in your city or county, right? And maybe that number goes all the way up to 4,000 people per square mile, whereas in some rural areas, that number may hit 400 at tops, right? So that threshold is available, and it's just looking again at the number of people per square mile. Next, we're looking at the uninsured population. So right now, that is indicated in yellow here on the map, and our threshold is set at 10%. So all of the areas that you see highlighted in yellow mean that they have an uninsured population greater than 10%. The areas that are not in yellow would have an uninsured population less than 10%. Again, you can move that threshold. Likely you're going to hit like a 15 or 16% rate kind of height maximum, but you could go down all the way to 1% of the population, depending again on what it is that you're looking for and the geography that you live in. Finally, we have population age 65 and over. Right now, we're looking at those areas in purple, and we have a 15% age 65 and older threshold. So again, all the areas that we see in purple have a population age 65 and older greater than 15%. So those are the individual indicators. Now what we're doing is that we're looking at the intersection of all three of those indicators. And that's where you're seeing the orange and the red on the map. The orange means that those areas meet two thresholds. So it could be population density and uninsured population. It could be uninsured population and population age 65 and over. It could be population age 65 and over and population density, right? Just two of the three thresholds are being met. So these are areas of concern. We would say that they have some vulnerabilities, and I would encourage you to click on those areas on the map. When you click on them on the map, you're going to get a little pop-up window that tells you the exact rates, right? It's going to tell you the exact population density. It's going to tell you the exact uninsured rate based on the data that we have, and it'll tell you the population age 65 and over. That's important to know because you may have an uninsured population threshold set at 10%, but the uninsured rate is actually 18%. And that's a huge difference. And so that's something important to note, right? Also, the other important thing there is that having those exact values can always be really helpful. It can tell you what two indicator thresholds are being met and what indicator threshold is not being met. So definitely click on the map. So that's really the orange areas. So then we get into the red areas, and that's the purpose of this tool, right? Is to identify where all three of those thresholds are met. And that is what we would call our footprint, right? And so those areas that we see here in the map, on the map, that are red meet all three thresholds for the indicators that we've selected. And so those would be the areas that we would consider most vulnerable, the ones that we would we would try to do the most outreach, education, provide the most support to. So just wanted to put that out there. You can save these maps. You can generate a report. It'll give you some additional information about linguistic isolation, rates of poverty, race, ethnicity, gender, those types of things. So would encourage you to do that, as well as add additional data to the map. You can add things like hospital locations, community health center locations, locations of schools. So a lot of really great functionality there. Finally, for 1 second, hey, Chris, are you telling me 5 minutes? Is that what I've got left?
Yeah, I think what we'd like to do is I would like to present a little bit on the Missouri Food Finder, and then also leave time for Q&A.
Okay.
So, yeah.
Okay, great.
So continue with this part right here, and then we'll do that.
Wonderful. So the last thing that we want to show, or last thing I'm going to show you, and I'll turn it over to Chris, is the testing dashboard. So as I mentioned, this was built in partnership with US News for an article that they pushed out last week about, are states ready to reopen? And so that's really what we're trying to answer here with this this testing dashboard. Is a state really ready to reopen by providing data for that? So a couple of data points that we're looking at are the number of positive tests, and then also we're also looking at 7-day tests per 100,000 average, and then we're also looking at the number of total tests actually given, right? So how many tests have been given and how many of those are positive? You can see here that a 10% or lower positive test rate has been cited as being a benchmark goal. And so that's really what we used to help us determine how we built this dashboard. So this first state that we're looking at is Georgia, because Georgia has been talked about a lot. And you can see here that we're tracking that 7-day percent positive test rate in the pink line. We have that 10% line as dashed. That's the goal, is to keep it under 10%. And then we have the tests per 100,000 people in purple. So we see that line going up in Georgia, but we still see it under that recommended number of tests per day. So that's really how you can read these dashboards. So what we're hoping to see, right, is that the more we're testing in every state, the less positive tests we receive. So we start to see some of that happening here in Georgia. As the tests start to increase, we see the number of positive tests go down, which is good. In New York, yet again, another state that's sort of been in the news and talked about quite a bit, we see, again, the number of positive cases. There's that nice curve, not nice, but a curve nonetheless. And then we see the number of tests given go up pretty significantly. So they really are trying to reach that threshold of recommended number of tests per day. Lastly, I think I have Utah here just because I know that Utah, Iowa, Nebraska, they've all kind of bought into the crush the curve. And so how is that working for them? You know, you can see that the number of tests per day has gone up tremendously over the month of April. And we do see here that the number of positive tests have been low. And that is just based on the data that we're receiving. So we do have some lags in some of that data as well. So with that, I'm going to go ahead and turn it over to Chris here, and he's going to talk a little bit about how we think about moving forward, how we think about recovery, some strategies that Extension can put into place, and that some things that Missouri have done. So thank you.
And thank you, Jamie. And again, can you hear me okay? Okay, good. Thank you, Jamie. And also some very good questions have been coming in, and we want to at least save some time toward the end for more questions, so please go to the Q&A area to put those in there. So Jamie shared with you a lot of data, indicators that have been rolled up. It's a lot of secondary source data. We hear so much in the news and different sources around how much we really know, how much the testing has helped out, how many people are actually infected, but we have not tested. So there's a lot that is happening that is still not clear. But what we do know is that we will be testing more, and that contact tracing is going to be really critical before there may be a potential vaccine. So as you see these dashboards change over time, and you get more testing and the different rates of positive tests, it's going to be probably more meaningful because we're going to get a larger end of the population that we're really focusing on. There's a lot of work left to be done, but what we've done with this dashboard is provided one lens, which is at a county level, but the other areas that, because we only have so much time, there are a number of other tools that you can actually look at county level data, but in the context of neighboring counties, looking at your region. So context is everything as well. Some questions came up. Can you go down to a city level? Yes, there's a wealth of data that we have at CARES that's publicly available at tens of thousands of mapping layers that go from the county to the zip code, the census tract, block group, down to block and point level data. There's so much data there, it takes a while to wade through. But what you can do is put the pieces together based on the issues you're addressing. And so again, that's through the map and reporting room. So there's different levels of granularity. That vulnerable population footprint tool that Jamie shared is a variation on what we've done with CDC and Kaiser Permanente around community health needs assessments and looking at poverty and education attainment. So we would welcome any input, any type of thinking on what other indicators or framing that could potentially be used in terms of a visualization. We heard yesterday on the news recently that African Americans are 4 times more likely to die than white populations from COVID-19. What do we look at in terms of populations, in terms of concentrations, where we need to allocate resources to really stem the tide of mortality? So there's a lot that needs to be done. And we really would welcome any input or feedback from you on what we could do. So with that, I want to pivot to a tool. So although we focused on COVID-19 and a lot of data related to that, we also showed economic data, we showed health data, mobility data, and social data. What our center is focusing a lot of time on is the long-term recovery. So it's not just around COVID-19 as the pandemic itself. It's all the ripple effects that are taking place, that are ravaging our economy, that are really increasing food insecurity and access. What do we do to really help people, not a year from now, through different large grants and contracts that many universities and organizations are really working on, but what do we do over the next 6 months? What do we do to meet the needs of people over winter? So as we were building out these different tools, a county engagement specialist or nutrition specialist came to our center and said, you know, we need to, thank you, Jamie, we need to go back and we need to better connect producers, local and regional food producers with customers. And what they've noticed, and this nutrition specialist is also, they have a farm as well, with a lot of fresh fruits and vegetables that they're selling. They saw an enormous uptake in the interest and people buying local and regional produce. And that has been heard time and again in terms of the need to better understand the producers, local and regional producers, and where they are, and to connect customers with them. So the Missouri Food Finder map is at its simplest level a way to do just that. A producer, a local producer, can just register their local food business by going through in about 5 minutes a simple survey. And with that simple survey, your hours of operation or days of the week, the type of foods you sell, is it eggs, fresh fruit, vegetables, meats, etc.? What type of payment options do you offer? What type of delivery or in-house service do you offer? So it's really meant to lower the barriers for people to connect with each other. Now, CARES has really reviewed and looked at many excellent resources around the country that do variations on connecting customers to producers. But what we've done is build this interface in a way that you can do searches and filters. I just want to look at eggs within 50-mile radius, or I just want to look at beef within 25 miles, or I want to look at all organizations that are food pantries or food banks. So that's what we've been doing. This site has been up and running for about a month. It's gained quite a bit of interest. What we have right now with Missouri Food Finder is we have it limited to the state of Missouri. Again, like all things, we try to figure out what's working, what's not working, and then with the opportunity of how we can scale this kind of a capacity nationwide. The infrastructure, the data, and the architecture is in place to do that now. The real challenge is how do we curate, how do we verify the locations as they're entered in? That's what the University of Missouri Extension is doing, is they're verifying different, as people are adding their locations to the map, they're verifying the locations, and then they become verified on the map. What is the modus operandi in other states? How do we go ahead and try to work together in making this available? Now, what's most important about the Missouri Food Finder is not just about building robust local and regional food systems and being able to work with our regions, but then if you go to the next slide, Jamie, is this all rests on top of our national interactive mapping engine. So as I've mentioned before, we have tens of thousands of GIS data layers, mapping layers that are available. So what we have here is a dynamic feed between the locations of all local food sources, but that's overlaid with all public school locations, median household income. And as we click to the next slide, we can zoom into Kansas City. We're looking at poverty down to the census tract level. The darker the color, the higher the poverty, the locations of hospitals, and what you're seeing there are the state Senate districts on this map. So again, it's what we do with the data that we have and overlay it with all this secondary data. I want to wrap up this part here by saying that the real opportunity with extension is not just with how we look at and frame secondary data, all of the census data, the health data, all of this data we've been sharing with you, but most importantly is how do we collect primary data? We have an incredible workforce across our country that is extension. And again, that's why we moved to extension, is because how do we marry the ability to tell the current story around conditions, around unemployment, around mental health, around closures of businesses or opportunities that are there. So that is the opportunity here, is with an example with Missouri Food Finder. How might this be with feed and hay and other types of markets where we want to connect people together in a more meaningful way? But also, how do we connect with our legislators, our congressional folks, with school districts, et cetera? That's really for all of us to figure out together. So we really appreciate your time today in terms of the formal presentation. And Jamie, for you presenting the dashboard, would love to get feedback, not just during the call here, but afterward by email. There's two websites. The national one is engagementnetwork.org, and it's built off of allthingsmissouri.org, and we can discuss that at a later time. Our contact information is here. So with that, we'll pause, and Jamie, how would you like to handle the Q&A side of this? So thank you all.
Yeah, sure. So I was just reading back through some of the questions, and it looks like, Chris, you and our team have been able to answer several of them individually. One thing that I just did want to touch on was we had a comment saying that, using the slider and using some of the dashboards, they weren't syncing up. And I'll tell you right now, at least from my own personal experience, when I have a Zoom running, I have some tabs open, and then I'm also trying to change locations in the dashboard. It kind of just eats up a lot of bandwidth. So I would recommend that you just maybe let it load for a minute, or if you can, close some other things. Of course, not our Zoom, but if you can close some other things, that might be helpful too. It just takes a little bit of processing time to process some of those data as you're switching between counties on the dashboard and within the maps. So wanted just to make that note as well. In addition to that, oh yeah, go ahead.
Yeah, I just wanted to answer that. Oh, go ahead, Jamie. Were you doing more context setting? Because there was a specific question.
Go ahead. Yeah.
Okay. So the question around the foodfinder.org. So it's Missouri Food Finder, but we also have the URL that we're working on. Again, this was all built just within the month, and we've already gone through a second version of the Missouri Food Finder tool. So right now it's limited in scope to entering in addresses and being able to put your points on in Missouri. The technology, the underpinning is available to scale this up. But it's not the technology that's the challenge. It's really the curation, the communication, and the verification process and how we all work together to make sure the integrity of the data is there and that it is current. So that's, I believe, in part to answering that question, Sam. Thank you for responding that in the chat there. I think, so Jamie, do you want to pick that back up?
Yeah, so we did have another question just to share with everyone about when we looked at that vulnerability footprint, and she was asking, the person asking the question was worried about us combining these populations. So her note was that population age 65 and over, they have different insurance needs, right? So just wanted to point out that here we're not combining indicators, we're simply looking at the intersection. So where we see some of those red areas, we're looking at the age 65 and over population as a single population and how or where they intersect with the uninsured population. So ultimately, we can't know if there's double counts or if some of those people belong to both groups, but nonetheless, it gives us an idea, right? It gives us a starting point. And I think that's really about what all these tools are about, is it helps us validate our local knowledge, things that we know are happening in community, we can validate it with the data. It can give us an idea of where to spend our money, our time, and our resources, and where we may have the most impact with those vulnerable populations. And then it also tells us what we're missing. What other unique conditions, as Chris is mentioning, or issues should we be collecting data about, because there are no national secondary data to help us determine the level of prevalence or how much of an issue it is. And so that's really what we see these tools being, is just a great starting point, especially as things are changing so fast, one, and as we think about how do we recover. Every community, I think what we realize, is going to need a recovery strategy that's unique to the people in their community, right? Not everybody has large populations of seniors. Not everybody has large populations of uninsured, but they might have populations that are really at risk because there's large asthma prevalence. There may be, those types of things. So that's what we're trying to help you guys get to, is what is it that we should be looking at, paying attention to, and caring about over the next couple of months.
And thank you. And Jamie, I just wanted to add that there's questions coming in the Q&A side as well as the chat side. So
okay, great.
Question around, are there talking points to use with the data to help interpret it? That's an excellent question. CARES, we have 18 full-time staff. We're all techies. Some are more geeky and some are more techie. But our strength isn't necessarily in the communications and rounding out in terms of what we wanted to get available immediately in terms of the dashboards. But that's something we want to follow up on in terms of the broader talking points to do just what you asked about. I just wanted to make sure that was addressed. And again, we're part of the equation here, and would really welcome feedback, any questions. Like Jamie said, this is moving very quickly. What are we missing in terms of data? What might be another vulnerable population footprint framing that we could be using that could help you and communities around the country? So with that, again, thank you very much.
If you do have questions, feel free to reach out to Chris or Sam or I. I know Sam's been sharing his email with some folks here in the chat, so feel free to reach out to us. We're happy to help, and if we can help provide some of that context for you, we can do that as well. So just really hopeful that you guys will share back with us if you have any ideas or ways that you've used this data. Feel free to email us with how you used it, those types of things, because we want to be able to share that back out. So we're not recreating the wheel, right? That's what Extension kind of does best, is really lift each other's work up and replicate and make impact. So that's what we're looking to do. So I appreciate everyone's time today. And Chris, do you have any final words?
No, thank you all. Appreciate it.
All right, take care. Thank you all.
Be safe.